Hello everyone. Today we are going to say about initial and daily assessment of newborn. It is very important. Why you all know? As because before the delivery, the baby has been experiencing only the intrauterine environment. So this is the first time the baby is coming out from the intrauterine environment. So it has to get adapted to the extrauterine environment that is in the world. So how it is going to adapt to such a new environment? So during the time of adaptation, so what are the things that we have to do? We have to check initially daily. Why? Because this initially and daily assessment of newborn is important. Why? Because to prevent the complications, if we can able to identify if we can able to identify these small things in earlier period, it will be very useful for us to manage it to prevent the complications. So this is Bhavani Tutor, Triplam College of Nursing, Obstetric and Gynecological Department. Objectives: to know about the meaning of the newborn, to identify the normal newborn, to enumerate the criteria for being a normal newborn, and to be able to identify any abnormalities in the newborn. Introduction: newborn refers to an infant in the first 28 days after birth. Newborn assessment requires thorough, skilled observation to ensure a satisfactory adjustment to extrauterine life. That's what I have discussed. Awareness to the expected normal findings during each assessment process helps the nurse to recognize any deviation that may prevent the baby from progressing eventually through any childhood period. So initial assessment of newborn, initial assessment using Apgar score. The score is based on observation of heart rate, respiratory rate, muscle tone, reflex irritability, and color. Each item is given a score of 0, 1, 2. At 1 and 5 minutes of birth should be checked. Score of 0 to 3 is severe distress, 4 to 6 is moderate difficulty, and 7 to 10 is absence of difficulty, and the baby is very well adjusting to the extrauterine life. So here comes the sign of Apgar score. So first is the heart rate, respiratory effort, muscle tone, reflex irritability, and color. So this is the scoreboard given. So according to that, the heart rate, how much scoreboard you are giving it. If it is absent, you should give 0. If it is less than 100, you should give 1. If it is more than 100, you can give 2. So this is what the scoring method in the Apgar system. So like the same ways, you will be giving a score to the respiratory effort, muscle tone, reflex irritability, and color. So second comes the clinical assessment of gestational age. We have to calculate the gestational age can be assessed by Ballard scale, which has a rating for neuromuscular maturity, so that we can able to find out the neuromuscular maturity and physical maturity. Baby born by 37 to 40 weeks of gestation is full term baby. Physical maturity includes skin texture, thick with peeling, cracking over hands and feet. So then you can see the lanugo, scanty lanugo with areas of baldness, and plantar crease deep by the deep indentation throughout the sole, and the breast nodule, breast tissue more than 10 cm diameter, and ear film, spina film with definite cartilage throughout, and instant recoil will be there. And comes to genitalia, male, at least one testis present in the scrotum, and for female, labia majora completely covers the minora. So neurological maturity, posture, legs flexed, abducted, while arms completely fixed. So this is the neurological maturity that we can see in the newborn baby. So neuromuscular maturity, so this is a position you can give scoring, and a square window, that is a wrist thing, and arm recoil you can check, and the popliteal angle, the leg, how is the baby is sticking out. And so that angle, and scarf sign, and next comes the heel to ear. That's the baby will bring the feet to the ear. So next, arm recoil, arm briskly returns to full flexion, popliteal angle 120 to 90 angle. So head lag, with baby lying in supine position, hands are grasped and pulled to sitting position. The normal unit brings the head anterior to the body. And this is a scarf sign with the baby in supine position. Support the head in the midline with one hand and use the other hand to pull the infant arm across the shoulder. So determine the location of elbow in relation to the midline. Elbow is not reaching midline is 4. You can give the score as 4. And next, the heel to ear. With baby in supine position, pelvis flat, pull foot as far as possible to the ear on the same side. Knees flexed with popliteal angle of less than 90 degrees is 4. So third comes the physical assessment. Here, the vital signs and the general behavior, that is respiratory rate, heart rate, blood pressure and temperature. So the normal respiratory rate should vary between 40 to 60 breaths per minute. Heart rate, that is 140 plus or minus 20 beats per minute, and the blood pressure 60 by 40 mmHg, and temperature should be around 36.5 degrees Celsius. So general behavior, observe for color, movements of limb, feeding and alertness of the baby. Anthropometric measurement, weight, normal weight is from 2.5 kg to 3.5 kg. So next is the length. It is around 48 to 53. It should be around 48 to 53 centimeter. Head circumference vary between 34 to 36 centimeter. The abdominal circumference 31 to, that is chest circumference 31 to 33 centimeter. And skin, the texture of normal newborn skin is velvety, smooth and puffy, especially around the eyes, legs, dorsal aspect of hands and feet around the scrotum and labia. Skin color is usually pink to red. Observe for jaundice, cyanosis, petechiae, birthmarks, hemangioma and rashes. In skull, you should examine for the caput succedaneum, cephalhematoma, forceps marks, encephalocele and widely separated or closed sutures. Examine the anterior and posterior fontanelle for size and tension. It should be flat when baby is examined in the sitting position. Face, look for the abnormal faces by paying attention to the shape, size, position of hair, distance between two eyes and their alignment. Examine for the position, structure and auditory function is assessed by using the startle reflex. And in nose, it is usually flat at birth. Bruises are common. Patency is assessed by noting passage of air. Sneezing and thin white mucus are common. Mouth and throat, check for cleft lip and palate. Palate is highly arched, rarely teeth may be present. Elicit sucking reflex, rooting reflex. Uvula can be inspected while the baby is crying and chin is depressed. And in the neck, you should observe for range of motion, shape and any abnormal masses. And in chest, the shape is usually circular, sternum is generally raised and slightly curved. Inspect the breast size, nipple formation, milk secreted due to hormonal imbalances and supernumerary nipples. Assess the respiratory rate, sound and heart rate. Abdomen, normal contour of abdomen is cylindrical. Inspect the umbilical cord for presence of two arteries and one umbilical vein. At birth it is bluish white, then it shrivels in size and turns greenish black. Abdomen, palpate after inspecting the abdomen. Liver, spleen, kidneys can be palpated. In lower abdomen, femoral pulses can be palpated, felt, which should be strong and equal bilaterally. Female genitalia, normally the labia majora, minora and clitoris are edematous. Vaginal discharge may be noted. Pseudo-menstruation may be present due to abrupt decrease in maternal hormones and disappears by 2 to 4 weeks. Vernix caseosa may be present in large amount between the labia. Observe for urethral opening. Epithelial pearls may be seen at prepuce. Scrotum may be large edematous. Palpate the scrotum for finding the descendant testis. Hips, examine for evidences of congenital dislocation. Barlow's test, flex and adduct the hips by bringing towards midline and apply tight pressure on knee and direct the force posteriorly. Positive, you can consider it as positive when the femoral head dislocates posteriorly from acetabulum. Dislocation is palpable as the head slips out of the acetabulum. Diagnosis is confirmed with Ortolani's test. Ortolani's test, you should flex the hip and knees to 90 degree. Thigh is gently abducted. Positive test is femoral head reduces in acetabulum. Audible cluck sound is heard as hip reduces. In back and anal, shape is gently rounded. Examine for spina bifida cyst. The presence of anal orifice and passing meconium in first 24 to 48 hours indicates anal patency. Extremities examine for symmetry, range of motion, check for polydactyl, syndactyl, muscle tone, creases and reflexes. And fourth comes the assessment of neurological system. Reflexes you should check here. Neonatal reflexes or primitive reflexes are inborn behavioral patterns that develop during uterine life. These are essential in newborn survival immediately after birth, which includes sucking, blinking, swallowing, etc. So these are all the reflex, that is Moro reflex, grasp reflex, rotating reflex, trunk incurvation, placing, tonic neck reflex and parachute reflex. So in description, Moro reflex extends the head and the extension flexion of arms and legs. It appears at birth. And in grasp reflex, finger in palm to hand, elbows, shoulder flexion. And the rooting reflex, cheek stimulus, turns the mouth to that side. Trunk incurvation, withdrawal from the stroking along ventral surface. Placing, steps up when dorsum of foot stimulated. Fencing posture when supine, that is tonic neck, and parachute stimulate fall, extends their arms. Except parachute, all other will be appears during the birth. So grasping reflex, when the examiner places his finger in the newborn hand, the baby immediately grasps the finger. Tonic neck reflex, extension of head results in extension of arms and flexion of legs. Flexion of head causes flexion of arms and extension of legs. Stepping reflex, it is observed by holding the baby in an upright position and touching one foot slightly to the flat surface. And rooting reflex, touching baby mouth causes baby to turn the head towards the direction of the touch and open the mouth. And sucking reflex, it is triggered by placing a finger or mother's nipple in the infant's mouth. The neonate will suck on the finger or nipple forcefully, rhythmically and coordinated with swallowing. Blink reflex is stimulated by momentarily shining a bright light directly into the neonate's eyes, causing the baby to blink. This reflex does not get inhibited. Babinski or plantar reflex, it is triggered by stroking one side of the infant's foot upward from the heel across the ball of the foot. Infant responds by hyperextending the toes. The great toes flex towards the top of the foot and other toes fan outward. It gets inhibited from 6th to 9th month. Moro reflex or startle reflex, when the infant is in the supine position and is stimulated by sudden noise or movement, results in symmetrical extension of infant extremities that is followed by return to a flexed position with the extremities against the body. So this is what when you will suddenly, when you give a noise or any sudden shock, if you are giving to the baby, there will be some extension of the infant extremities. And a crawl reflex, it can be stimulated by placing the baby in prone position. The neonate will attempt to crawl forward using arms and legs. This reflex diminishes by 3 to 4 months of age. Clavicular reflex, it is elicited by taping the newborn in between the eyebrows, causing them to blink. An extrusion reflex, when the tongue is touched or depressed, the newborn responds by forcing it outwards. This appears by 4 months. So all over we have seen about the reflexes and the initial assessment. What are all the things that you have to see in the skin and in the genital area and or in the ear and in the extremities and the other things. So by knowing the normal findings only, you can able to identify the abnormal thing by finding out the deviation from the normal findings. So this was the bibliography and so thank you. So thank you.